So for our next speaker, he's Dr. Anuar bin Abdul Samad. He's the Senior Deputy Director of the Medical Development Division for Emergency Services and Disaster Management Unit, Ministry of Health. And he will be talking today about the role of Medical Development Division in developing a trauma system. So we welcome him on stage.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good afternoon to everybody. Okay, first and foremost, I would like to thank the Secretariat for inviting me and have successfully organized a very meaningful and significant event in terms of strengthening our Malaysian trauma care system. Number one. Number two is probably I want to congratulate and thank everybody who has been working very, very hard in making this Malaysia Trauma Registry a reality. Yeah. So I nak minta semua everybody give a round of applause. Because this is a very, very significant step. Yeah. Towards the development of the trauma care within this country. For those yang tak tahu the impact, I think probably you won't see, but for those yang memang within the trauma care system tu, you will know how significant this milestone that we have already achieved ni. All right. So what I am going to talk about is the role of Medical Development Division in developing a trauma system. Next slide, please. Oh, I can control it myself. Okay. All right. So, apa itu Medical Development Division? I think some of us tahu, some of us are not very familiar with it. So, Medical Development Division is a division under the purview of the Medical Program, Ministry of Health, which is responsible in strategizing, planning, and implementing all policies, medical-related services at all MOH hospitals. Yeah. So including the development of specialty and subspecialty service. That's the main role. So under the Medical Development Division, we have 4 big sections. The one that I am from is a Medical Services Development section. And from there, where I am, my unit are being placed lah. So specifically the Emergency Services and Disaster Management Unit. So this is relatively new. Yeah, it only being established last year because previously it was combined with the surgical unit. But then after COVID, after all the things that we have gone through, we decided to separate it. Yeah, so and develop it separately, but still within the framework that we have already planned. So the unit that I'm from is under the purview of course the Medical Development Division, which is entrusted to look into all matters related to the emergency and trauma services in all MOH hospitals. So this will include policies and guidelines formulation, specialty and subspecialty services development, special project coordinations with entities outside MOH, including NGOs, emergency services database management, as well as these are relatively new lah. And the last one is emergency service quality monitoring. All right. So before I go further, I just want to highlight. I think probably most of us knows about this. So this is a very brief introduction into what is being called a trauma care system lah. Okay. If we compare between high-income countries and our country, our beloved country, which is now being recognized as an upper middle-income country. So, kalau throughout the continuum of a trauma care system, we know that we have the pre-hospital part, the definitive care part, ataupun hospital base. Yeah, boleh. All right, thank you. As well as the rehab part. So, in terms of the difference between high income and Malaysia, for the pre-hospital part, so for high-income countries, usually they are part of a public safety organization, which is usually under the fire and rescue department. Okay. And then the model that they use, majority mix lah, Anglo-American, and some do use Franco-German model, which is the stay and play model. And then a majority of them also the personnel that leads the team, the pre-hospital care team, majority paramedic. But for Franco-German model, they have physicians, yeah, to lead, in which they bring the hospital towards to the patient themselves. Okay. Whereas for us, of course, we are mainly Anglo-American, scope and run. It is part of the public health organization, as well as, and then the last one is, of course, we are being the team, the ambulance team are being led by assistant medical officer. For definitive care part, okay, this is very significant lah. I mean, in terms of the development of trauma care system, of course, we are far behind. Yeah, okay. In high income countries, they have designated dedicated regionalized trauma center as well as trauma team. Yeah, whereas for Malaysia, we are very lack of it. Yeah. We do have one national trauma center, which is Sungai Buloh, and we are slowly developing similar services in other parts of the country. But we have to, I mean, there are a lot of challenges that we have to face, but we will try our best to try and make this a dream a reality. Okay, and last but not least is, of course, the rehab part, okay, in which for high income countries, usually they are well integrated into the system. This is also another aspect that usually being neglected, yeah. All right, for Malaysia, we are still at an early phase of integration. So a lot of things that we have to do and improve to make things at par with other countries, especially from the high income countries. Okay. All right. So before we go further, I just want to show you what do we have now. Yeah. So for 11, we know that we have our Malaysian plan. Yeah. So in 11th Malaysian plan from 2016 to 2020 under the MOH specialty and subspecialty framework. So at the end of the 11th Malaysia plan, now we have about 49 specialty services and subspecialty in 14 state hospitals, 20 services in 27 major hospitals, 10 basic services in 18 hospitals, and 26 regional services in 6 regions, which are the North, East, Central, South, Sabah, and Sarawak. Okay, so we know that emergency medicine and general surgery are considered as basic services. So in terms of provision of this service, we are, I mean, providing basic services, I think we are quite, I mean, we are doing okay. Yeah, all right, and are available at all minor, major, and state hospitals. Yeah. Trauma surgery is considered as a subspecialty. So it is only available at selected hospitals. So they are being offered as a regional service. Yeah, all right. Again, trauma medicine, a subspecialty ataupun an area of interest, subspecialty lah, under the emergency medicine itself, are also available at certain states. And again, this is also, we call it what, regional services. So whereas for rehab medicine, the whole country, I mean, it is available at all states except Perlis. Yeah. So at the end of 11 Malaysia plan, that is our status. So how do we go forward? Okay, for 12th Malaysia plan, 2021 to 2025. So I think probably some of us are very familiar with this term, the cluster concept. So in which from individual hospitals, they are being grouped into a group entity in the same locality, headed by a specialist hospital. So at the moment, we have about 17 clusters throughout the country. And the ultimate aim is to increase it to about 42 clusters, in which all hospitals are going to be a part of a cluster system. So this is our way forward, yeah, to ensure that all the services, especially specialty, subspecialty services, are accessible to everybody in the country. Number one, we are not abandoning the regional service because we know that some specialty are very limited in terms of the human resource, yeah, and the expertise. So we still keep the regional services, but instead from 6 regions, we are trying to increase it to about 10 regions, in which addition of 3 new regions in Sabah and Sarawak respectively. So instead of Sabah and Sarawak being 1 region each, yeah, it is going to be divided into 3 regions for Sabah and Sarawak. Okay, so again, this is in the hope that we can try and make all the subspecialty services ataupun the very, very critical and very low in number of expertise are still being accessible to everybody. Yeah. Again, the prioritization of services are the way forward for us is we are going to try and our best to develop about 10 to 20 specialty services in all clusters. Okay. As well as the main region that we are going to focus is mainly East Coast, Sabah and Sarawak. Yeah. Specialty and subspecialty services are to be addressed according to main disease groups with leading cause of death and disabilities. Yeah. All right. So other factors that are going to be taken as a factor include logistic, geographical issues, of course, population density, workload, and complexity. Okay. So what have we accomplished so far for trauma medicine? Okay. First and foremost is our Trauma Life Support Malaysia. Again, this is a very significant milestone that we've already achieved. So I would also like to congratulate and thank the team that has been working very, very hard in developing this, especially the TLS subcommittee under our NCOT. Yeah. So TLSM, of course, is the first Malaysian standardized training module for TLS. So it was developed under the purview of our NCOT, National Committee of Resuscitation Training. And it has already evolved from just simply creating a standard module, but they have also provided standard provider manual, training slides and visual aids, training videos. These are all accessible from their website. Yeah. All right. So for the time being, we are doing our training of trainers and a roadshow, which is currently ongoing. All right. To introduce this system. So in terms of with the introduction of this TLSM, we hope that we can increase the competency of all our staff. I mean the staff that are going to act as our frontliner, especially in terms of trauma. Okay, what need to be done further? Okay, this again these are all based on the collaboration ataupun the input that we've got from our partners overseas lah. Number one, of course, the G4 Alliance. What is actually G4 Alliance? G4 Alliance is a coalition of association and organization around the world working to increase the awareness, foster political will, etc., especially to make access to quality, safe, timely, and affordable emergency and essential SOTA, surgical, obstetric, trauma, and anesthesia care a global health priority and a reality for all. So from here, from their 11 recommendation that they've already provided, four to seven are related to trauma. Yeah. First one is, of course, establishment of an appropriate pre-hospital trauma system, training of first responders, training of trauma providers, as well as institution of trauma audits as a quality improvement strategy. These all the recommendations has already been proven, and to reduce mortality and morbidity arising from trauma. Okay, of course, again, we have our own plan, what we call Plan Keselamatan Jalan Raya Malaysia 2022 and 2030. So what is the aim of this plan? The plan is actually mencapai sekurang-kurangnya 50% pengurangan bilangan kematian akibat nahas jalan raya pada tahun 2030. So you think that this can be achieved? I don't know. But what we can do is we will try our best to do our part, which is specifically related to BK10, the bidang keutamaan 10 for pasca kemalangan, yeah, post crash initiative. So there are a few strategies that they have already been suggested. There are a few plan of action that we're looking into it, and we are working very, very hard to achieve all the indicators ataupun the threshold that we've already put for ourselves to try and hopefully contribute to the larger extent the objective of this plan. Okay, where are we compared to the rest of the world? One important thing is the WHO 5th Global Status Report on Road Safety. All right. These are going to be used to benchmark ourselves with the rest of the world. Yeah. So MOH Malaysia acts as the national data focal point and collaborated with other agencies with data collection. So hopefully, by providing the last report was in 2018, if I'm not mistaken. Yeah. So hopefully, with this report, we can use it as a benchmark to compare ourselves, to see where we are. Yeah. In terms of road safety, as well as the management post-crash and everything. So the report is going to be scheduled to be published in Q3 2023. Okay, I think this is the last slide, my last slide. So how do we move forward? Okay, with the establishment of this Malaysia Trauma Registry, as what I mentioned just now, which is a very significant milestone that we already achieved, and hopefully we can continue developing it, is of course, the first is for prevention and public education. Using the data that we can obtain from this registry, hopefully we can come up with better prevention program, which can be implemented later. That's number one. Number two, of course, strengthening of the current trauma care system. So again, data from this registry will be used to strengthen, to plan further the current system throughout its whole continuum of care, from the pre-hospital part, definitive care, rehab part, as well as reintegration of trauma patients into the society. Okay, last but not least, of course, this is a very crucial point that I want to make, is the national trauma policy. It has been in the works for the last few years. So hopefully it can be revisited and hopefully it can be published soon enough. With this help of the help of this registry, hopefully an evidence-based policy can be formulated and continually be improved. So I think that's about it from me.